Hello, Facebook family. Good morning. Welcome once again to your Saturday online clinic. My name is Regina Asker Williams, and I'm reaching you live and direct from New York City. It's always a pleasure to have you with us. Happy 4th of July to all the Americans in the house. Happy American Independence Day. It's a pleasure to have you in the house with us. Today is supposed to be a happy day, but for most of us, it's bittersweet because too many of us have lost somebody, some family members, some friends, some grandparents, some loved ones. We have lost them to COVID. So today we are going to talk about COVID-19 and all the updates, the new news we have on COVID-19. All right, so get your pens and pencils because there's a lot you're going to have to learn, or there's a lot we're going to share today, and there's a lot of new things you're going to learn. Okay, so today we're going to talk about how COVID attacks your body. We're going to talk about what to do when you have been tested positive for COVID. We're going to talk about surviving the infection. Is there a chance for a reinfection? What do you do if you suffer a reinfection? Okay, and this video is going to be on my YouTube channel, Regina TV Regina Asker Williams. Click on there, and while you're in there, don't forget to like and subscribe. Okay, all right, click on there. This video will be available. We also have like a COVID diary link where you can download papers that will ask you about your symptoms and take you through what to do through a 14-day quarantine period. Okay. All right. So we'll be talking with Duchess Nena. We'll be talking with a COVID survivor, and we'll be talking to a dear friend of mine from Akwa Ibom State. We want to explore how Akwa Ibom State is handling the COVID situation. Are they doing well? Are they offering enough testing to the people? I was hoping we'll be able to talk about COVID in Akwa Ibom State with the Commissioner for Health in that state, but unfortunately, I have not been able to get a feedback. But I will work on it and I will serve it as it comes in. Okay. Um, so let's get to a guest. I'm happy I have my first guest in the studio. My first guest is Azuka Jibose. His name is Azuka Jibose. We're going to meet him in a minute, and he'll talk to us about how he was able to survive COVID. Sir, you're welcome to the studio.
Thank you very much for
All
having me.
right, please tell us your name and what you do before we go into this very interesting COVID story. And congratulations. Thank God for your life.
Thank you very much. My name is Azuka Jabose,
Uh-huh.
and I live in North Carolina.
Okay.
And I'm a content provider, and I have an auto business, which Azuka Autos, which is auto vehicle business.
All right. So, take us through your journey. How did you get exposed to COVID in the first place? What happened?
It's actually very difficult because my business is public interaction. But on that day, every Friday, every weekend, we get these cars delivered to us, and
Yes.
I got this young kid that always Nigerian that um, he's a very good mechanic. So he came by and I got my vehicles delivered at the store. So I went down there. It was unseasonably hot in June,
Yes.
and
It was unseasonably hot.
in June, yeah,
Okay.
for us
Yes,
here.
because I mean we heard stuff about the virus and heat. Okay.
Yeah,
Okay.
unseasonably hot in June. It was early June. I think it was June 2nd or 3rd. So
Mm-hmm.
I was like, I was sitting and while watching, and I said, I'm kind of dehydrated. I'm hot. He said, he gave me Gatorade, and I started, that's when I actually noticed a flu-like symptom. And then
Okay.
after that, the next day, that night, I was coughing and I was uneasy.
Yes.
So because
Wheezing, coughing and wheezing.
yeah, and then I've been following the history and the information. I was tracking COVID
Yes.
for my family and for myself. So I told my wife I needed to go to the hospital. I wanted to go to the urgent care, thinking that they will do a rapid test.
Yes.
So I went to the urgent care and I explained my circumstance to them, and they said
Mm.
okay. So they did the test and told me it was going to be 3 days before the results got back.
Yes.
And I was like, wow. So I came home that night. I started noticing breathing and oxygen drop, but I didn't know what was happening. So the next day continued while I was trying to wait. My daughter called and said, "No, Dad, you need to go." She called an ambulance.
Okay. What happened? Why did she call an ambulance? You were wheezing. You
I
couldn't
was
breathe.
I was wheezing. I was gasping for breath.
Okay.
I hadn't gone to the bathroom in 10 hours.
Oh,
As soon as I came home, I immediately separated my family, my wife, um, from me and my daughter.
yeah.
So
But after the symptoms, this is when you were exhibiting symptoms.
the symptoms, yeah,
So you don't know exactly when you had gotten the infection.
no.
Okay.
So, but my wife also immediately after I did the test, I began to notice she was also exhibiting the same symptoms. So I
Yeah.
took her back. I took her to the urgent care center to do the test
Yeah.
so that we'll be able on the safe side. But as soon as we came back, we separated. I kind of went into isolation.
Mm-hmm.
And I stayed in isolation. My daughter talks to me and my wife, and so I was coughing. I hadn't used the bathroom. I couldn't eat.
Mm-hmm.
To go to the bathroom. In my daughter's room, from my daughter's room to the bathroom is about six
Mm-hmm.
steps to her own bathroom. That's my
And you
second
couldn't
daughter's room
walk.
where I was. Yes, like 6 steps, but it takes me 10 hours. And when I go to the bathroom just to pee, I will stay there gasping, coughing, wheezing, losing breath, and try and get myself together.
Mm-hmm.
And the coloration of my urine suddenly changed into dark brown.
Dark brown. Okay. Okay. Did you have any temperatures?
Yes, I had a temperature of 101.
101. Okay. All right. So now you went to the hospital.
So the ambulance came and got me,
Yes.
and they treated me. They ran all the EKGs and all the tests and everything else,
Mm-hmm.
and the hospital concluded that I don't have any underlying medical challenges. I don't have high blood pressure, diabetes, heart
Mm-hmm.
problems, you know. So they concluded I was one of the 95% strong people that will be infected, that it will run its course. Just go back home, and
Mm-hmm.
if if the symptoms continue to get worse, I should call them. So after about 7 hours, I was discharged.
Yes.
Yeah, and also the hospital then did a rapid test and
Yes.
confirmed that I was infected.
Yes.
So when I was discharged, that was the night. I went home and I was so uncomfortable.
Mm.
I was choking. I was still so through for the whole day.
Yeah.
It, it was getting worse. It was
So you
getting
went back to the hospital?
no. I hadn't gone back to the. I was trying to wait for the hospital. So the second day afternoon,
Yeah.
my daughter called again. I was like, I'm calling them back. So she called 911
Yes.
again, and they came quickly.
Mm-hmm.
And by the time they came upstairs and strapped me and started rolling me downstairs, I had fainted. I had passed out. So they rushed me to the ER, and about by the time I got there, I had regained a little bit of consciousness. So I had about 6, 7 healthcare givers all on me by, alone. And I believe because they did that because I was previously there, about 2 days earlier.
Okay. All right. So we are really happy to have you out. Okay. So when you were in there, I know the protocol. They're going to start you on oxygen therapy, and
Yeah,
they're going to do blood work to measure the amount of oxygen in your blood. And you're
exactly.
going to have x-rays to show how your lungs are being
Yes,
affected by it.
yes,
And then they will keep you there and do another test.
yes.
So when you did the second test, was it positive or negative?
It was positive. The
Positive.
first test that day was positive. The second test confirmed positive.
Okay.
So I had two positives,
Yes.
and that was when, by the time they were done, they moved me to an ICU room.
Mm-hmm.
My oxygen level was seriously dropping, so they had to
Yeah.
immediately put me on a tube,
Yes.
an
So
oxygen
you were on a ventilator?
no, on a tube,
Okay, high flow.
the high
Okay.
field, yes. So,
Yeah.
and they started running so many things on my drip. So,
Yeah.
they now moved me to an ICU and a room, and that was around 9 p.m. I got there about 1, 2. So by the time there were two, yeah, about 1, 2.
Okay.
So, yeah, so the next morning,
Mm-hmm.
an infectious disease doctor came,
Yeah.
spoke with me, spoke with my daughter,
Yeah.
and confirmed that I have pulmonary. You're a nurse, so you should know the my lungs. My
Yes.
lungs were collapsing. My
Yes.
oxygen level was down, and confirmed to my daughter that, and also said that I qualified for the remdesivir
Yes.
treatment,
Mm-hmm.
and it was going to be a 5-day dosage, and
Yes.
I will have to stay in the hospital for a very long period of time because they have to observe me, monitor me, and also see the side effect and what the 9 yards you guys go through.
Mm-hmm. Okay. So how are you feeling right now?
I'm in recovery. I give thanks. It's not easy.
Mm-hmm.
The worst is past.
Oh,
Because I was in the hospital for about 12 days,
yes.
confined to a bed. I'm having to relearn how to walk normal.
Yes.
I have to. I can't climb upstairs effectively.
Yes.
I can't lift things,
Okay.
and I'm fatigued. I'm tired,
Mm-hmm.
and it's
But you're alive.
a long journey. Yeah, but I'm alive. I can at least I'm proactive.
Yes.
I like to.
And you're taking your medication,
Yes, I was
your
told.
vitamins.
I'm off all medications now because of my immune system and because of my health history.
Okay.
They didn't want to bombard me with so much medication. So what the last they gave me was the steroid, and
Yes.
honestly, I'm eating up the whole house.
All
but
right.
but
Are you on? Are you still on oxygen therapy? Because I saw your oxygen carrier right there.
yes, apparently I to be honest with you, I've only used it twice. I tried to self. I believe in not, let the body heal itself,
Yes.
through, and it's what
Getting your lungs stronger.
yeah. After I was discharged,
Yes.
I had a home health. They phased me into a home health, which
Yes.
means the nurses come every day
Mm-hmm.
and talk and make sure I'm okay. And so yesterday actually was the day they officially
Took
uh,
you
the
off
first phase
everything.
of the first phase of discharge was yesterday.
Okay.
So I'm out of isolation now. I can go places
Yes.
if I want to,
You
but I
still
have to be
have to
very
wear your mask
careful. Yeah,
though.
I have to wear my mask. I have to be very careful. But
Yes.
I
What did
really,
they talk to you about? What did they say to you about a reinfection?
yes, the reinfection is possible right now. Number one, this is how it works. The reinfection, because my lungs are still weak and vulnerable, I can be reinfected
Mm-hmm.
by a carrier if I'm
Mm-hmm.
not within the next 10, 15 days. But I cannot infect you or reinfect anyone.
Yeah.
Yeah.
Okay. We thank God for your recovery. How is your wife and the rest of your family?
They're all fabulous. Thank you.
All right. Thank you for coming on the studio today. And there'll be questions in the timeline for you. So if you're strong enough, please go on a timeline and help us answer some of those questions. We appreciate you. Thank you so very much.
All right, thank you. Bye bye.
Have a beautiful day.
Thank you. Bye bye.
All right, everybody. That was very interesting. I hope that you listened to his story and you're motivated that coronavirus infection is not a death sentence. So he went to the hospital. He was treated in the hospital. The good thing he said was that he was on top of his immune system health. He was on top of the health of his immune system. Now, he was exposed to the virus at his job, because at his job he meets a lot of people. Now, you know what could have prevented that? Wearing your mask. Okay, if we had known way back in the day that this is how the virus is transmitted, and he wore his mask, that would not have happened. Now he said something about his dark brown urine. Dark brown urine is happening because your blood vessels are getting involved. Your blood system is getting attacked. So when your kidneys process it, your urine will come out dark brown. Okay, this virus attacks every single organ in your body, and we're going to talk about that, the process of the attack, in a little bit. But let me speak with Duchess. Duchess Nena is a vegan chef. Okay, more and more we're realizing how important what you eat is to your system. You are indeed what you eat. So there's no two way about, trying to cut corners or trying to, not care about what you put in your body. You have to. So you have to be careful of what you put in your system. So let me talk with Duchess about foods we can eat to protect ourselves from exposure to coronavirus. Please pay attention, okay? And this video will be available on our YouTube channel, Regina TV Regina Askia Williams. Go on there and learn something, because coronavirus infection is real. Okay. All right, Duchess. It's a pleasure to have you. Look at you looking all beautiful. Welcome
Thank
to
you so
Saturday
much.
Online Clinic. Thank you for taking time to.
Thank you for having me. I
You're
think this
very
will be
welcome.
my second time.
Yes, this will be your second time with me, and we always learn something new, right? Okay,
Yes.
so you listened to our first guest, right? He was talking
Mm,
about the process of his infection, and
mm,
right now, I would like to go through the process of the infection by COVID, and what foods will help our bodies negate, all right, or mitigate the effects of that
yeah.
infection. Okay, talk to me a little bit about yourself and what you do.
Okay. Like you rightly introduced me, I'm a vegan chef and I'm also a herbalist.
Mhm.
So it's all about using the food that we eat to actually heal our body or maintain healthy balance. And obviously, we've got to understand that our immune system can actually be improved through the food that we eat.
Yeah,
And there are certain things that we should actually stay away from as well
yeah.
to obviously increase our immune system. So
What are some of those things we need to stay away from?
salt intake, if you can minimize, keep your salt intake to a minimum, sugar intake to a minimum, alcohol to a minimum, that would absolutely help.
Yes.
Yeah.
Okay. All right. So let me ask you now, in the COVID treatment agenda, or in the COVID treatment protocol, big on the list is vitamin C. Okay.
Yes.
Another
Mm,
one is vitamin D. We
yeah.
have vitamin E, and then we have zinc. Okay.
Yeah.
Now,
Yeah.
let me talk about vitamin E for a few minutes.
Okay.
It's been researchers have discovered that one of the ways that COVID affects the body is by causing blood clots in the
Mm,
system. All right, it
yeah.
affects your blood vessels and it causes blood clots in your system. And when
Yeah.
it does that, you find people you find people who are asymptomatic, people who don't have any signs of cough, cold, sneeze, or anything like that,
Mm,
suddenly dropping dead. Okay,
yeah.
it's been found that these blood clots travel and block blood supply to organs like the heart, the kidneys, the
Mm,
liver, all that, even the brain. When it
mm,
blocks up blood supplies to those organs start to fail. All right.
mm,
If it's a
mm,
massive blood clot, somebody dies suddenly in their sleep. Somebody
mm,
suddenly cannot breathe and they pass. You know,
mm,
you have this embolytic issues or events, and people die. Young people who did not
mm.
show any symptoms, young
Anytime.
people
Yeah.
who did not have any health history or comorbidities. So
Mm,
vitamin E is one of the vitamins that keeps your blood thin, and when you keep
mm,
your blood thin, it minimizes the possibility of forming blood clots. Talk to me
mm.
about some of the foods that can provide us with vitamin E. The
Okay, I've made like a very short list.
yes,
Wheat germ,
yes,
sunflower seeds,
yes.
almonds,
Mm-hmm.
peanuts,
Yes,
red bell pepper, beetroot,
yes.
spinach, tomato, broccoli, and chickpea.
All right. I hope everybody's
Yeah.
writing that down. I hope everybody's writing those foods down. All right. Okay. So now, after vitamin E, we have vitamin D.
Yes.
Vitamin D is so important, and
Yeah.
this is one of the vitamins that our bodies cannot store, so we have to replenish every day.
Yeah.
And to activate the production of vitamin D in a system, we need a lot of sun, right?
Yeah. Yeah.
When black people go in the sun, because of the melanin, we do not absorb it,
Absorb. Yes.
you know.
Yeah.
So we need to stay out there as much as possible
Hmm.
without sunscreen, but you have to find a balance where you don't burn yourself up, but then you absorb
Definitely.
enough sunlight, okay, to
Yeah.
activate the production of vitamin D. All right.
Hmm.
So talk to
Yeah.
me about some of the foods that will provide vitamin D to our system.
Yeah. But you see, because obviously I preach plant-based,
Yeah.
so the number one plant-based food that you need for vitamin D is mushroom.
Okay.
And to be able to heighten the potency of the vitamin D in
Yeah.
mushroom,
Yes.
it's always advisable to leave your mushroom on the windowsill. Obviously, the window has to be open because if you put it on the windowsill and you have a glass, it could cut down the amount of sun coming to it. But
Mm,
if you leave it outside, obviously before 12, early in the morning, so that it can absorb as much vitamin D as possible, then when you consume it, it goes straight into you. And the other thing is supplements.
yes.
So if you feel that you're low in vitamin D,
Mhm.
always have some supplements to actually keep you going.
All right, great. Now, the important thing about supplements is the fact that, everything we put in our bodies,
Mm,
it gets digested, okay? And when
mm,
it gets digested, some of the nutrients are lost. So consider
definitely.
that before we eat it, we prepare it. So in the cooking
Hmm.
process, some nutrients have been lost. When we
Yeah.
eat it, our bodies digest it. In the digestive process, some nutrients have been lost. So by the time, it gets to be absorbed by our system, it's very little left. This is why we need to supplement our supply
Mm,
of the vitamins. Okay. Now, thank you for that, Duchess. Another thing I want to talk to you about is vitamin C. So we've
yeah.
gone from vitamin D, E, and C. What are some of those foods that can help us shore up our supplies of vitamin C?
Obviously, the obvious ones
Mhm.
are obviously oranges,
Mm.
lemon, lime. Then you have things like papaya,
Yes,
and you've got parsley,
yes.
thyme, broccoli.
Mhm.
This particular one, I absolutely hate it, but I have to eat it. Brussels sprouts. It
Okay.
tastes so disgusting, but it's really good for you.
Yes.
And then strawberries, all the berries, because
Mhm.
of the high antioxidant nature of them as well. Yeah.
Yes. Okay. All right. Do you have any other thing to add in terms of food choices and vegan lifestyle that will help us shore up our immune system?
I think another thing I would add is obviously exercise more and
Yeah.
eat more fiber, because obviously when your digestive system is moving correctly, your body maintains a more kind of like alkaline state.
Great. Yeah.
And when your body is alkaline, you would definitely be able to fight anything that comes your way. So that would be that. And then, I always encourage people to eat less meat.
Yes.
Telling people to stop eating meat, I've noticed has not worked. But when
Mhm.
you tell people cut down amount of meat you're eating to
Yeah.
give your body a fighting chance,
Hmm.
at whatever, like whenever people have health crisis, their GP always, or their doctors always, I always say GP, but GP is
General
general practitioner.
practitioner.
Yes, so that's a UK term, just in case people are not from here.
Mhm.
But they usually tell people just go plant based.
Yeah.
So if you're eating plant based already, then you can fight whatever is coming to you as
Yes.
opposed to going plant-based to solve a health issue.
Okay. Thank you so much for spending time with me this
Thank you
morning
so
or
much.
your afternoon. It's a pleasure to have you. And I'll come back to you from time to time for updates on the vegan lifestyle choice. Okay.
No problem. Thank you so much.
Thank you. Have a wonderful day, Duchess. Thank
And
you.
you too.
Thank you.
Bye.
All right. So you heard that. You heard it all. I hope you wrote those down, but it will be available later on. So don't fret. Okay. So now I'm going to go to AKS, Akwa Ibom State, before we get into the meat of today's discussion. Okay. I hope you have your recharge cards ready. We're going to get in the meat of today's discussion because this COVID thing is not a joke. Too many people are passing, too many people are coming down with this infection, and too many of them are not doing well. So I'm going to go through line by line of everything I wrote down to discuss COVID with you because we are not going to be found wanting. Okay, we're gonna give it our best shot in terms of fighting of this infection. Okay, let me welcome my friend from Akwa Ibom State, Miss Imaobong Akpan Akpan. Imaobong Akpan Akpan, it's a pleasure to have you with us in the studio. Please talk to us about what you do, who you are, and what you do in Akwa Ibom State. One second. One second. Please start again. Go ahead, please.
Hi, Regina. Good evening from Nigeria.
Thank
Nice
you.
to
Good
have you,
evening
program.
to you too. Yes.
Okay, my name is Imaobong Akpan Akpan. I
Mhm,
am a radio presenter
mhm.
of Team Nigeria Classic, a youth-based. I work with a youth-based NGO,
Yeah.
and I'm a socio-political analyst
Wow.
based in Rio.
Okay. Social political analyst. Are those not the troublemakers that
Oh yeah, that's when we are fully occupying our office of the citizen
all right.
of Nigeria.
Absolutely. Absolutely. Okay. Welcome to Saturday Online Clinic. You are in this clinic because everything that happens in our communities affects our health. So
Hmm.
getting you from the Office of the Citizen to talk about the citizens of Akwa Ibom State on Saturday Online Clinic is in line. Is in line. So talk to me about the COVID situation in Akwa Ibom State. Are we doing well? Are there enough testing sites to go around? I mean, I know there is like 31 local government areas. How many testing sites do you have? Talk to me about that, please.
Okay, we have just one testing center, though we have three isolation centers.
Mm-hmm.
So far, the combined capacity of the isolation centers are 330,
Mm-hmm.
about that, and which is very inadequate. We are hoping we do not have a situation where the COVID-19 positive patients get more than this capacity. And so far, the number tested, the number of the COVID-19, the number of people tested are just over 600
Yeah.
so far.
Yeah.
And you know that is grossly inadequate.
Yes.
Looking at a state with a population of roughly 5 million or more, 600 is very poor.
Mm-hmm.
uh, it's not just applicable to Akwa Ibom State anyway, because Nigeria, we are still very much under tested. And so far, officially, the number of deaths from COVID-19 in Akwa Ibom State is two. That's the official statistic. But
Okay.
we really can't tell if we have to talk about those who are yet to be tested in
Mm-hmm.
the villages who have probably died and didn't know exactly what must have killed them. So, but the official mortality statistic is two.
Okay.
And then talking generally now, when COVID 19 came, the pandemic started, it was really a shock, as it was all over the world, to Akwa Ibomite.
Yes.
The whole thing pushed us inside our houses. And but so far, with the less mortality rate in Nigeria, it looks like people are not really taking it seriously,
Mhm.
taking COVID-19 seriously the way it should be. I really do hope we won't have the kind of death rate that we are seeing in some countries like Spain and like in other countries in Italy and
Mhm.
even in the US. I hope it doesn't get to that extent.
Yeah.
But right now, a bit of confidence is restored. People now are confident we are in charge or we are on top of the situation, or so it appears.
Yeah.
We are also hoping that people are not dying from this virus that are grossly unreported. That
Mhm.
is really our hope. And so far, talking about transparency now, especially here in Akwa Ibom State, a lot of people, I would say, do not have much confidence in the
The news report.
transparency, degree of transparency from government. As at yesterday, the new statistics of COVID-19 positive patients had increased to 19 new persons tested positive in the state. And most of them are actually made up of people close to government. But
Yes.
how about, because some of my friends working in government house had told me they were instructed to go for their test. So
Yes.
if government house staff had gone for tests and then they make up the number of these new 19 positive cases,
Yeah.
what do we make of the rest of the indigenes?
Yeah.
I mean, we have about 5 million indigenes of Akwa Ibomites.
Yeah.
So what happens to the rest of the people who do not have access, who are not privileged, to be tested? Uh, the people are falling ill every day out there. How are we sure they're not infected? How are we sure they're not dying? And so we need to step up
Yes.
regarding the testing capacity.
Yes. Okay, I absolutely agree with that. The need to step up, providing testing centers because it's easy to set up, right? I run a COVID unit testing center out here. It's easy to set up. It's easy to get people to come in and get tested. So I don't know why it would be such a difficulty to set up at least 31 COVID testing units in the 31 local government areas because it's really simple to set up and the collection procedure is not intense. It could be taught to a few nurses and a few nurse aides, but they
Mm,
be on top of teaching them how to protect themselves with the PPE because the virus is highly infectious and very highly contagious. So I do look forward to a situation where the next time I speak with you, you'll be telling me that those centers have been established and testing capacity has been heightened, or elevated in Akwa Ibom State. All right.
mm.
Any message for your viewers, for your fans watching you? Because most of them came up here to hear what you have to say, but they're not asking any questions. Linus Oko says, Ima, I guess that's a form of saying hello to you. Any message
Yes.
for your fans?
Okay. So I would like to especially acknowledge and thank our medical personnel, from the doctors to the nurses, the pharmacists, and every medical staff and personnel whose hands have been on deck in fighting this invisible enemy, the virus.
Yes.
Um, they've been on the forefront of the fight, and we really want to say a big thank you to them.
Yes.
Uh, I want to especially appeal to the government, first of all, to provide more PPEs
Yes.
for medical personnel because the ones available are actually very insufficient for them. And also, there is a need to look into their welfare. Some days ago, some medical personnel had gone on strike at
Mhm.
this particular point in time. That will be unfortunate,
Mhm.
but there is a need to sort them out. There is a need to make paramount the welfare and the well-being of medical personnel in our Ibom
Absolutely.
state. Yeah,
Absolutely.
that is very important. And also going forward, I want to see government establish and equip more primary health care centers especially at the ward levels, because the teaching hospital, for example, is getting overwhelmed. The
Mm-hmm.
teaching, the only teaching hospital we have in Akwa Ibom State, which is the University of Uyo Teaching Hospital, you get
Yes.
to see more cases that ought to be handled at the primary health level, and of course at the secondary, end up going to the teaching hospitals, which is not supposed to be so.
Mm-hmm.
So I encourage the Akwa Ibom State government to equip and establish more primary health care centers, and
Yes.
also the secondary health facilities like the general hospitals. We have new ones in Ona, for example, and few have been renovated. But especially in Uyo, the capital city of the state, we do not have a government general hospital, and that sounds strange, but that is the truth. And that's the secondary, healthcare facilities that should be taking a bit of the stress of teaching hospitals. So I'm
Yes.
especially appealing to the Akwa Ibom State government to look into this. And then finally, my appeal to them is on subsidizing health care bills for the indigenes. We should have government subsidized healthcare programs whereby our indigenes who really cannot afford to take care of their health can walk into hospitals and have their bills subsidized. I know that we can afford it. We receive one of the highest monthly allocations, and so I know we can actually afford these kind of things for the indigenes. These are my thoughts, and I'm especially thanking everyone who tuned in to follow us on this program. Thank
Thank
you
you
for
so
listening.
much. Well said. Well said. Thank you so much, Iman. Thank you for spending your afternoon with us. Okay.
Thank you. Thank
Uh,
you, Regina.
it was a pleasure to have you. Have a
All right.
beautiful rest of your day. Bye bye.
Thank you very much. Bye.
Bye bye. All right, everybody. Thank you for joining us on this beautiful 4th of July. Now we're going to get into the meat of the situation. This is the meat of the discussion. Bring out your pens and your pencils, your papers. Make sure you write these things down, okay? All right. So now, before we go any further, let me take you through how COVID attacks your body, okay? Now, we have been talking about wearing the face mask, hand washing, and social distancing. But sometimes you find that despite your best efforts, you get exposed to somebody who has tested positive to the virus and does not know, or who is asymptomatic and they don't know that they are carrying the virus and they're spreading it. And somehow you get to contract the virus, and a test shows that you have tested positive to the virus. Now what do? You have to understand how this virus is going to affect your system. In that way, you understand how you take care of yourself. Okay. The good news is that some of us, or many of us, will just have mild symptoms and will be able to overcome it. But for far too many, because one death is a death too many, um, for some people, okay, the impact of the virus on their system will be such that they will require hospitalization, require oxygen therapy, and maybe even end up on the ventilator. So let's go through how this virus wreaks havoc on your system, okay? Researchers have found that this virus affects every single thing in your body, okay? We used to think that it affected only your lungs, the angiotensin converting enzyme receptors on your lungs. But you find out that the receptors, the ACE receptors, are not just on your lungs, they are on the stomach lining of your walls, they're on your heart, they are on your blood vessels, they are everywhere. Okay. When they're on your blood vessels and they affect your blood vessels, remember, your blood vessels carries blood to every part of your body. That means that the virus will travel to every part of your body. Okay. So now, when the virus gets to your brain, the way it will affect your brain is by forming blood clots in your blood vessels. And when the blood supply to your brain is blocked, what happens? The brain is starved of oxygen, and you suffer a sudden ischemic stroke, or an embolus. It blocks the supply to your brain. That oxygen levels fall. Your brain starts to die, and you're gone. Okay, that is how it affects your brain. Sometimes it also um, affects the transmission because in some people we notice they're unable to taste food, okay? They're unable to smell. So it does affect some of the nerves that run in our from our brain to the rest of the body. All right. Another thing we notice is the COVID eye. I'm sure you most of you have not heard of the COVID eye. The COVID eye looks like pink eye, okay? Nigerians call it Apollo, okay? We notice the COVID eye also because the blood vessels supplying the eyes are affected, and we see that in most patients that have COVID, right, around their eyes will have dark circles. You know, in white people, it's very visible in white people. In colored people, in darker skinned people, it's more difficult to notice. But you notice the COVID eye in many white people, and when we see that, we get concerned because it means that the disease has progressed to affecting body organs, and we have to stay on top of it. Okay. All right. I talked about loss of smell and loss of taste. Okay. These are early signs, early warning signs in a COVID infection. So if you have a new onset of symptoms where you cannot taste food and you cannot smell, please consider having a test and consider isolating yourself. Okay. um, the gastrointestinal system. Some people that have contracted the virus find that they are vomiting a lot and they are going to the bathroom a lot. They suffer diarrhea and stomach pains and things like that. Okay, remember we have angiotensin converting enzyme receptors also in the stomach. So this virus will attach on it, on these receptors, invade the cells, replicate itself, travels to the rest of the body, wreaking havoc every step of the way. In one or two programs ago, we discussed how it attacks your lungs, okay? Attaches to the receptors again, affects the way surfactant is produced in your alveoli. Alveoli are those little bags in your lungs that encourage oxygen exchange. When the virus attacks it, it's unable to effectively exchange oxygen. And when your body does not have oxygen, you know that it is downhill from there. Okay. All right. The virus also attacks your heart. All right. Your heart muscles get attacked, and when this is involved, it causes dangerous arrhythmias. Arrhythmias are when your heart is not beating in sync, synchronized as it should be. And when it does that, it means that electrical impulses are not traveling from the different sections of your heart the way it should be traveling. And when this happens, blood is not pumped correctly. And when blood is not pumped correctly, we have pooling in certain parts of the body, and that is when blood clots start to form, and that is when we have problems. Okay? The kidneys. When blood supply is blocked, when blood supply is blocked to the kidneys, it starts to malfunction. All right. Do you see how we're having multi-organ involvement in this situation? And when there's multi-organ involvement and different body organs start to shut down, death is imminent. Okay. So even before a person gets to the ventilator, we had started noticing kidney damage in the patient that was, found to be COVID positive. So part of the protocol was to monitor the kidney function. The color of your urine will give us an immediate idea of what is going on with your kidney. All right. If there is breakdown of red blood cells, your urine is going to be dark colored. So we're monitoring that, and we're monitoring the amount of urine you're making per hour, just to make sure that it's not shutting down or you're not suffering from any type of acute kidney injury. All right. Another new symptom from COVID infection. Sorry, I get dramatic sometimes. Another new symptom of a COVID infection is a rash, right? In fair skinned people, the rash is visible. Okay. Um, this rash is formed from the attack on the blood vessels. Okay, we see petechiae, we see the purple rash, and in the dark skinned people, we also see some discoloration, some rash discoloration. Okay, all right. So your immune system, we already know that your immune system has to be, functioning at its utmost capacity to be able to survive infection from COVID. All right. When COVID invades the body mounts a serious attack, trying to attack the virus and trying to contain it. What happens is that during the process of mounting this attack, the body releases a lot of byproducts that are toxic to its cells. Okay, so it looks like our bodies have turned on us and started to attack us. Okay, because the byproducts of this of your body trying to fight off the virus causes a hyperinflammatory state in our system. And we have the kind of situation we have is similar to sepsis, okay? And we have to start treating this situation. We have to stay on top of treating this situation so we have good outcomes for the patient, okay? All right. So, having known all that, what do you do if you have been found to be COVID positive? The first thing we do is to isolate ourselves, right? Isolate yourself, go in self quarantine, and follow a given protocol. What is the given protocol? Remember that being COVID positive is not a death sentence, okay? When you go in your house and quarantine yourself, if your symptoms go out of hand, please do like Mr. Azuka did, call the doctor. If you go to the hospital and they send you back home and you're still not doing well, please go back to the hospital, okay? Because it happens so quickly. When you have that blood clot, it happens so quickly that you pass so quickly. When you have shortness of breath and inability to breathe, it also happens so quickly that you pass. We usually use a pulse oximeter, a small device that you put on your finger, will tell you the amount of oxygen in your system. Okay. The thing with that is, with the COVID patient, we see what is called happy hypoxemia, meaning that even with very low blood oxygen levels, the COVID patient is still able to carry on working like they're okay, but suddenly they crash. And when we take their blood and measure the blood levels in the hospital, we see very low oxygen levels in the blood. So you have to be on top of checking yourself to make sure that you are able to correlate symptoms with how you feel. Extreme tiredness is a pointer or of a pointer to lack of oxygen, right? Shortness of breath, where your body is working hard to try and get more oxygen in, is a pointer, okay? Don't wait until you're totally out, like Mr. Dribble said, fainted on his way. Don't wait until you're totally out before you take care of that situation, okay? So when you're in quarantine, what do? You give yourself a 14-day window of observation, okay? From the day you think you were exposed. For the first 4 to 5 days, okay, you are going to start noticing symptoms. These symptoms, you might notice all of them, you might notice some of them, okay? You're going to have fever and chills. What do you do then? Make sure you have a thermometer in the house, in your COVID isolation case, all right? The supplies. Make sure you have a thermometer. Measure yourself, take your temperature every morning and every evening. If it's over 100.4 degrees Fahrenheit, please take Tylenol, okay, to bring the fever down. It is very important you bring the fever down, okay? You might also notice cough. Now, if you're going to use a cough syrup, use the expectorant. The expectorant encourages coughing. It makes you cough up the phlegm that is settling in your lungs. Because if you use a suppressant, you suppress the need or the natural reaction to cough. When you cough up all the things that are settling in the lungs, and then you clear the airway, and then oxygen exchange is improved when the airway is cleared. Okay. Shortness of breath, please be on the lookout for shortness of breath. As a matter of fact, this is one of the symptoms for which you should seek immediate medical attention. Fatigue, like I said, is as a result of not having enough oxygen to the body. Muscle pain, body ache, feeling like you've been run over by a truck is also a symptom of when there's not enough oxygen supply to your system. Your system starts to use an alternative way to create or manufacture energy for the cells to use. Remember, they use oxygen for their processes. In the absence of oxygen, they use another cycle that results in the production of lactic acid. Lactic acid is toxic to your system. This is why you feel pain all over. Okay, we talked about loss of taste or smell. We talked about sore throat. Okay, use salt and water, gargle to um, rinse out your throat. Remember, the virus collects at the back of the throat, so rinsing it out, okay, reduces the viral load. You might also have a symptom of congestion or runny nose. Now, there's something called chest physiotherapy. Chest physiotherapy is, you know, having someone who is wearing a mask, okay, give you little taps on the back like that, okay, from bottom to top when you're in the prone position, okay. What that does is it encourages movement, okay, movement of phlegm and everything like that up to the upper chest, and encourages expulsion of these things so that they don't settle in the chest and cause pneumonia, okay. All right, we talked about nausea and vomiting. When you're nauseated and vomiting, you have to replenish the fluids, because if you lose fluid, you get dehydrated. If you get dehydrated, you lose fluid volume in your system. When you do that, we have other issues that you do not need to have when you have a COVID situation. So stay on top of your fluids. Have your family make you those favorite soups. Stay on top of your fluids. Another thing the fluids do, apart from maintaining general fluid volume, is loosen the secretions, make them lighter. Okay, so you're able to cough them out. If they're sticky and thick, it will be more difficult to expel. All right, you may experience diarrhea. Diarrhea is another way you lose fluids from your system, and it is important that you replenish the fluids you have lost through diarrhea. Okay, those are some of the symptoms you might have. Now, in young people, okay, young people are usually asymptomatic, but we did talk about the blood clots. I can't stop talking about these blood clots because this is where the sudden deaths come in. This is where the sudden ischemic, like strokes and all those things. This is when it happens. So you have to be on top of it, especially when you have been found to be COVID positive. All right. Now, how do you prevent blood clots from forming? This is where your vitamins are very important. Okay. You do not have any other symptoms, but you're COVID positive. Please, this is a very serious message for the colored people. I don't want to say black people, but it affects us seriously. With the blood clot symptom is the ones that really get to the black people. Okay, so taking your vitamin E. Vitamin E is one vitamin that keeps your blood thin. Okay, other vitamins do that, but vitamin E especially is one vitamin that keeps your blood thin. So stay with that. Okay, take a lot of vitamin E to help keep your blood thin, so you don't have those traveling blood clots, you know, in your system. All right. Now, I have to mention that if you have comorbidities, you have to be careful also. People who have comorbidities of diabetes, okay, of high blood pressure, okay, of cancer, asthma, a heart disease, obesity especially, and renal disease. People like this should be really, really careful, okay? Because you are already in a hyper-inflammatory state, right? And when you have a COVID situation, your body goes into inflammatory overdrive. That means you're going to get a double whammy of this inflammatory reaction, and it doesn't, you know, make for good outcomes for the patient. Okay, so now we're still talking about what to do when you're in quarantine. Okay, we talked about staying home. We talked about putting yourself, in a room, isolating yourself from other members of the family. We talked about wearing a face mask if you have to go outside. All right. Talked about covering your cough and covering your sneezes. Achoo. That's it. Okay. All right. Monitor yourself for the severe symptoms that we have mentioned. Take your temperature twice a day. Um, this is a little personal. When you're in the bathroom, cover the toilet lid before you flush because they say flushing, the process of flushing aerosolizes the virus, which people also shed in their bowel movements. Okay, so when you flush, it aerosolizes the virus, it gets it in the air, and people coming in there after you will breathe it in. And that's, that doesn't make for good outcomes. So please cover the toilet lid before you flush if you have been found to be COVID positive. Okay, so you monitor yourself for 14 days and monitor yourself for those symptoms. Manage those symptoms as much as you can. In the event of not being able to breathe, please immediately go to the hospital. Now, there are some of us that have oxygen at home, use oxygen therapy. Please discuss with your doctor about how much oxygen to put yourself on, okay? Don't go and turn it up to 6 liters, 7 liters with no monitoring, because when you expose yourself to excess oxygen, you actually depress the ability of your system to breathe on its own. Okay, so we have to be careful about the oxygen that we have in our homes, because some of us have little oxygen tankers in the house. Okay, no smoking by the oxygen tank, and do not put it near an open flame, because what you'll have right there is an explosion, and you don't want that. Okay, all right. So in your COVID supply kit. All right. Now, when you monitor yourself for 14 days and you've been able to arrive at a temperature that you do not need to regulate with Tylenol, this is the beginning of your recovery. Okay. Your body is able to control the temperature. You're able to not have those symptoms. You're able to breathe properly by yourself. You're able to control the diarrhea. You're not nauseous. You're not vomiting and all that. You are slowly coming out of your, isolation, your required isolation regimen. Okay. All right. Now, when you come out of isolation, okay, it doesn't mean that you should run out there and be free and not take care, because what has been noticed is that when the virus gets in a person, for example, if I was COVID positive and I'm able to beat it and come out of the COVID infection, I will still be positive because my body has built antibodies against the COVID. Now, having built antibodies against the COVID, it means if I am exposed to another COVID situation, the infection on me is not going to be that deleterious. It's not going to be that dangerous for me. All right. Now, everybody that has survived COVID, right, their body has been able to contain the virus, to attack the virus and contain the virus. So if they are exposed, or if somebody else who did not have COVID is exposed to them, the infection that person will have is going to be by a weakened COVID virus. Okay? Okay? Because my body was able to denature it. So if I infect you, the COVID you have will be from a weakened COVID virus. And this is why most people have been able to get away with not dying from the COVID, because if they caught it from somebody, they have caught a weaker version of that virus. Now, pay close attention. Pay very close attention. Now, if my body is able to denature and weaken the virus, some people's bodies may not have been able to do so, and the virus might have mutated in that person's body and come out a stronger version. So now, if somebody catches that stronger version, how are you going to deal with the virus? Remember, there is no treatment yet. Vaccinations are still in the works. We still have a long way to go. So the sensible thing to do is to wear your mask, maintain social distancing, use your hand sanitizer, and prevent an infection by this virus. Okay, somebody says, what about aspirin? Sorry, I've been talking. I didn't read the question. What about aspirin? It does keep your blood thin too, but There are people who are allergic to aspirin. Okay, so I cannot say to everybody, oh, take baby aspirin every day. No, your doctor has to examine you, run some tests, and make sure that you're not allergic to aspirin. Aspirin does keep the blood thin. Okay, people who have had strokes in the past, they are put on aspirin. Aspirin keeps their blood thin. Okay, all right. So we have talked about infection, surviving the infection, and reinfection. Okay, so now let us talk about one thing before we continue. There are some exercises you do to keep your lungs strong after you have survived the COVID infection. Okay, I have a glove here. All right, I have this glove right here, and I had a glass of water. Now, when you survive the COVID infection, or if you're in quarantine and you want to make do exercises to strengthen your lungs, which is very important, you have to strengthen your lungs. Okay, there's something we call the inspiron. The inspiron in the hospital, when you suck air up the inspiron, there's a bead on that device that rises up and tells us your lung capacity and the strength of your lungs. Okay. But if you're home and you do not have an inspiron, blow into anything that will require that, you force your lungs to work. Okay, that could be a balloon, that could be a glove, anything that has you blowing against pressure works your lungs. So let's blow on this. Okay, don't let the children take this and start blowing and biting on it, because if it gets into the throat, it's difficult to bring out. All right, so let's blow. See. Okay, when I blow, I empty my lungs, and the process of bringing air back in actually makes my lungs work. Okay, so do that as often as 10 times within the hour. 10 times within the hour. Okay, again and again and again. Okay, when you do that, you strengthen the function or the strength of your lungs. Okay, now from people, especially elderly people or children who are not able to blow into anything, give them a straw in a glass of water and have them gently blow into the straw. Okay, it the process of blowing provides resistance. It makes their lungs work, however weakly, but some lung exercise is going on. Keep your questions coming in. I'll do my best to answer. Okay. All right. So we have talked about those things. There's treatment therapy going on now. New things have been discovered. The newest drugs to treat COVID with is is remdesivir along with dexamethasone. We used to use hydroxychloroquine and azithromycin, prednisone, vitamin C, and zinc. But we have found that people at home were like taking too much of the hydroxychloroquine, and it has some very serious side effects, right, that we could not monitor. So researchers have also found that it's not necessarily effective against the COVID. Okay, so they found that it causes arrhythmias. It makes your heart beat out of sync. Okay. It also causes hemolysis of the red blood cells. So they advised against using hydroxychloroquine. I mean, there are people who have something like lupus that need to use hydroxychloroquine, but they're being monitored by the doctor. Today we use remdesivir, okay, on a 5-day treatment therapy. We use that to it's an antiviral that helps contain the virus. We also use dexamethasone, but the CDC warns that dexamethasone is to be used only in patients who are requiring supplemental oxygen, people whose oxygen levels are very low, people who cannot breathe by themselves. Okay, they use dexamethasone, which is a kind of steroid that helps calm the inflammation in the lungs and calm inflammation in the system. Okay, so after saying all that, I hope that you will find time and go on my YouTube channel, Regina TV Regina Askia Williams. Go on my YouTube channel and get this video, write everything down, and follow that protocol if you have been found to be COVID positive. I also have a small form on my YouTube channel. You can download this form, fill it out, right? Because it will ask you your symptoms. It will tell you what to do if you have such and such symptoms. It will tell you the questions to ask your doctor. It will tell you what to have as medical supplies for your COVID isolation, okay? And all that. So be sure to go on my YouTube channel. And when you're there, please click like, share, and what do they say again? Subscribe, right? Okay, thank you. So I have a small pack here. Okay, this is a pack of face masks. Let me talk about an agenda my friend is running in Nigeria right now to supply 1 million face masks to Nigerians. We have face masks. Please wear your face mask. Wear your face mask. Well, shall I make it a song? Please wear your face mask. Okay. This is the thing that will protect you from breathing in viruses and prevent your own viruses from going out there if you have them. So please wear your face mask. Okay. And get your zinc. Get your zinc. Do you see zinc? Get your zinc. All right. Why is zinc so important? Zinc is important because it reinforces the activity of your T cells. Your T cells are the biggest soldiers when it comes to fighting inflammation in your system. Zinc reinforces the activities of your T cells, okay? You can get zinc through food, but your body digests it, so you don't have all the nutrients in there. This is why you need the supplements, okay? Zinc also helps some medications work better. So use your zinc. Vitamin D. Vitamin D is critical, especially for Black people. Vitamin D is critical. Now, when you go out in the sun, if you have COVID, find time, wear your face mask, and go out in the sun. Get in as much sunlight as you possibly can. Now, there is some kind of correlation. Let me tell you something, okay? COVID in Nigeria is called a big man's disease. The big man in Nigeria sits in his air conditioner all day. He eats mainly processed foods, packet foods that come from the supermarket and all. He hardly goes out in the sun. He hardly sweats, so he does not lose calories. Does he exercise? I don't think so. All right. So we have a diabetes prone patient right there in the average Nigerian big man. So all this predispose the so-called Nigerian big man to contracting the COVID virus. You see, um, compare that to the Nigerian grassroots person. Okay, this person is out all day working in the sun. His vitamin D levels are high. This person is eating mostly cooked food or foods, closer to the ground. Okay, the vegetables, the gari, the beans, the rice, the spinach, and all that. So his system is healthy. All right. This person has maybe suffered malaria and whatever, and his system can recognize this kind of situation where your blood vessels are impacted, your blood cells are impacted, and it's on the ready, okay, as compared to somebody who has never been exposed to that kind of situation. So what I'm trying to say is, Black people, please take your vitamin D. It's so serious. Take your vitamin D and spend as much time as possible as you can in the sun. Don't get fried out there and don't catch cancer from, sunburn. Stay in the sun as much as you can take, okay? Take out time to walk around. Okay, exercise. The blood clots will form if you don't exercise. So take out time to walk around and exercise. Okay, so that we were talking about vitamin D. Okay, then we have vitamin C. Vitamin C. You remember when I said that in fighting the virus, your body releases a lot of byproducts that are toxic to your system. This keep your body in an oxidative state. Vitamin C reverses the effect of those things in your system. So you need to be on top of your vitamin C. This is vitamin E. Vitamin E, fish oil, cod liver oil. This is what keeps your blood thin. Okay. Folic acid. All those young ladies that are watching this program, if you're going to have a baby one day, or you need to take 1 tablet of folic acid every day, okay? Because it helps prevent or protect your baby from developing neural tube defects. It protects the health of your own nerves, the things that cover your nerve and the function of your nerves. Okay, so take your folic acid. Okay, so having said all that, it looks like I have come to the end of today's discussion, and I hope you learned something new. Hand sanitizer, all right? Gargling, to gargle the back of your throat, reduce your viral load. Temperature, okay? The thermometer to take your temperature every day, morning and evening. Honey, put a little honey and lime in hot water every morning, okay? And I have here ginger and lemon, okay? When you chew raw ginger, it kind of burns, right? It's very effective for your respiratory health. So stay on top of your raw ginger and your raw lemon, okay? So we have had a long discussion today about new findings on COVID infection and what to do if you've been found to be COVID positive. I hope you learned something from our discussion today. Go on my YouTube channel and watch this video again if you need to. Download your forms, fill them out, and discuss with your doctor. Okay, it was a pleasure to have you with me. This conversation continues on Facebook, so ask your questions. Our doctors will go on there and answer them for you. All right. To all the people who have lost family to the COVID-19 infection, family, friends, and all, our prayers are with you. Okay. May they rest in perfect peace. All right. And for the rest of us, may God continue to keep us in His care. And we're going to fight this virus every step of the way. Okay. Fortify yourselves. If you have to go screaming and fighting. Okay. All right, but may we not go before our time, and may it please God to keep us, to enjoy the length of our years. Thank you so much. Until next Saturday, I'd like to say good night. God bless. Take care of yourselves and of each other and stay COVID free. All right. All right. Before I go, let me tell you about the 1 million face mask project. Okay. We're coming to give 1 million face masks to Nigerians. And please be a part of this project. Go to the website and register. Okay, support us. We would appreciate that. How do you support us? Take a video of yourself in your native language. Speak vernacular. What this does is to help people, know more about the virus. Tell them about the face mask. Tell them about hand sanitizer. Tell them about social distancing. Okay, together, let us keep ourselves and our communities COVID free and healthy. All right. And so this is where we call it a wrap on today's Saturday online clinic. Till next Saturday, I'd like to say good night and God bless. See you next week. Bye bye.